This discussion is intended for educational and informational purposes only and does not constitute as medical advice, diagnosis, or treatment. The views and opinions expressed by Dr. Archie Hearne III are based on his professional experience and general medical knowledge. Medical cannabis laws, eligibility, and regulations vary by state and are subject to change. Viewers should not use this content as substitute for professional medical advice. Always consult your professional physician or qualified healthcare provider regarding any medical condition, treatment options, or before making decisions related to medical cannabis use. Participation in this discussion does not establish a doctor-patient relationship.
Good afternoon, everyone. Good afternoon. Welcome to Pyramid Art Books and Custom Framing and Hearne Fine Art, our first Wisdom Wednesday of 2026. Can everybody say 2026? Are you writing 2026? I'm not yet, but I am so happy that you're here today. A little bit about our Wisdom Wednesday segments. They are primarily for people who are retired or about to retire. And this is for us to, I say us because I'm right in that range. I'm not retired, but I'm not ready to retire. But at any rate, we want you to be prepared. We want you to have a full and live your best life, not and have items and things that you want to do. So we've covered a lot of topics, but today is one that I'm really excited about because I don't know a lot about it. It's the medical use of cannabis. And today we have our very special guest, Dr. Archie Hearne, who happens to also be my business partner. Let's give him a hand. And my husband, yeah, forget about that. Um, but at any rate, he's been practicing medicine for over 40 years, right next door. And we're excited to have you today. So, with no further ado, Dr. Archie Hearne.
Coming. This presentation is going to be fairly simple, and I'm going to give you a little outline of how we're going to approach this. Our biggest concern is Arkansas's medical marijuana situation, but I'm going to give you a little history about marijuana, and then a little history and information about the product in terms of the history of it, where we start using it, and then I'm going to veer off on why it may became illegal, and that I have to let you know that it is still illegal. I have to also let you know that I'm not endorsing any product, nor am I providing any medical advice or providing any prescriptions. So we know that marijuana is a plant. There are two types of plant. There is the basic cannabis and the hemp. The hemp plant in ancient times was used for food, rope. It wasn't used as much medicinally. But when we get into the two basic, what we call endocannabinoids, CBD and then TCH, I'm going to explain those things to you. The hemp plant has been used since time immemorial. Cannabis has been used since time immemorial, but when we actually start to date it, we go back to the 1600s when people first came to America. They used the product. They didn't smoke it. They used it for medicinal purposes, which purposes I'll tell you in a second. When we look at the history, and we're going to do it on a timeline, there was a guy named O'Shannagy. This gentleman had a product back in probably the 1920s where he had morphine, alcohol, and THC in a product. They used that constantly. Okay, that was one of the medications used for pain, anesthesia. That existed until 1937. The government decided with the Marijuana Act that it couldn't be used. So we legalized, or we made marijuana a Schedule I drug. And a Schedule I drug sits with morphine, Percocets, those type of drugs. So it is an illegal drug, and it is not FDA approved, so it's not prescribed. And one of the biggest problems we have in America is that when we say, well, how does it work? Well, the Israelis, the Canadians, and the Europeans, they're more familiar with how it works and what it's used for because they've done more research. If you were to do research in America, you would have to get the plant from the US government and you have to get sanctioned by the US government. Now, there is 2 products that are used that are FDA approved. One is for complex seizures, and there's another one called Mirinol. If you're pregnant, you have hyperemesis, you're vomiting, you could use it for that reason, okay? Okay, so, and then we go back some more history. Obviously, the Chinese are much more advanced. They used it. Then we go to, we'll give you a little timeline here. In 1970, it was designated had already been designated as a Schedule I, but I don't think, we had DEA in 1937. But by 1970, it was definitely designated as a Schedule I drug. You could not basically use it. And then by the 90s, they did a little research, and they realized that it did have properties that were considered medicinal but yet not approved. And there were brain receptors. That when they discovered there were these receptors in the brain. You have pain receptors and things like that, but we have over 100 different products that come from the plant that have activation on the brain. You have 2 different receptors in the brain that respond to the 2 different types of medication. Now, why do you think they made marijuana illegal? Well, in World War II, there were 2, actually World War I, there were 2 major companies, Pfizer, Merck. Merck was noted for morphine. Pfizer was noted for the codeine products. Well, these were not taken orally. They were used as a wrap in the military times. A person would have injury, they would literally wrap people with these things. And then so Pfizer, Merck are responsible basically for a monopoly, okay, and the alcohol industry. So they said, well, marijuana, we don't know about it, but we're not going to bring it on the market because it's cheaper and we're making more money off of Percocet and morphine. So they moved on with that. By 2000, Oregon was one of the first states to legalize it. Now, was it legalized for medicinal purposes, or it was legalized for recreational purposes? They were the first. And then now, currently, 2020, this time, it is still Schedule I. When Trump said he was thinking about making it nationally legal, well, he wasn't talking about recreational. He was talking about making it medicinally legal. Now, if they make it medicinally legal, it has to go through FDA approval, and then it's going to be a whole new cycle, because then it opens up research. The reason we don't have research now is because it is not a legal drug, and then the pharmaceutical industry has inhibited the research. Now, the biology of the plant, like I said, it has 100 different chemicals in it, that cannabinoid, and then 40% is CBD, okay? And you have these receptors. You have a CBD1 receptor, a CB2 receptor. The CB1 receptor responds to pain, anxiety. The CB2 has a lot to do with the immune system, because you hear that always about immune drugs. Well, it has an immune effect. So basically, we call those 2 products, THC and CDB, we call them endocannabinoids. Now, what is the difference between, first of all, go back to hemp and cannabis. You know what hemp is, right? They grow that everywhere. It takes a lot of processing to get CBD, the anti-inflammatory medication, out of that plant. And it's a smaller plant, longer stems. While cannabis has nice flowers, small, and it takes less to grow, and it's less contaminated too. So if you're thinking about smoking hemp, because you can get it somewhere, you don't want to, because it's usually contaminated with pesticides. While on the other hand, because it's regulated now, the marijuana you get here, which is highly TCH, tetrahydrocannabinol. Now, people say, well, how do they work? Well, we know that tetrahydrocannabinol is an alcohol, tetrahydrocannabinol. So if you drink any alcohol, whether you drink gin, whiskey, wine, you get an effect where everybody gets a particular high off of the particular drug they take or alcohol they take. And so they talk about the psychoactive part or the euphoria. Well, that exists. So back in the 1600s, not 1600s, 1800s, there was a doctor who had done research in This is it. Here, let me read this to you. This is about 150 years ago. A French psychiatrist, Dr. J.J. Moreau, conducted a novel clinical experiment in which he administered hashish, which is basically marijuana. It's just concentrated. I don't know if anybody's ever had it, but it's kind of grainy and concentrated. People usually smoke it in a small pipe. His volunteers included Moreau himself experienced occurrences of delirium or actual madness. I mean, that's how they describe it. Remember the word reefer madness that people used to use? He concluded that this is not a single elementary manifestation of marijuana users today, a mental illness, and cannot be found for mental changes caused by hashish. In contrast, most marijuana users today will presumably state that their senses appeared enhanced, concomitant with a increase in relaxation and euphoria, and forgetfulness is enhanced. Their focuses on their surroundings are augmented. I mean, those are some of the thoughts as to what the product is. That was 150 years ago. Now, we come up to date, and we know currently that, that the product, let me get to that part here. After we talk about not so much the indications, because indications is like if you get pneumonia, the indication to take an antibiotic is there. It's been researched, it's proven. As it relates to the conditions in Arkansas by which you are allowed to use the product are listed on this page. If you grab this page, and then when we go down this page, I'm going to mention these conditions and say something about it, because the important part is what does it do, how does it work. First of all, marijuana does not cure anything. It is a palliative treatment. You know, like someone's dying and you decide to give them morphine until they die. Well, it's not that extreme, but in this situation, it is very palliative, and it does have some direct effects, like stopping seizures. Those are the biggest research is done. And the big research is in hyperemesis. You know why? Hyperemesis is vomiting. Why so much research done in that? Because they found out that people who smoke marijuana excessively, one of the major side effects was vomiting. So obviously we have to research this. So they found that it was particular to the amount that you took and not the type, that some people develop vomiting from taking it, but also it treated nausea and vomiting. So let's just go through this list of diseases. Cancer. So why would we take marijuana for cancer? You've got malignant cancer, because with cancer there's a lot of anxiety associated with it and also pain. Well, it doesn't treat the cancer. It relieves the anxiety associated with it. It makes you more restful, and that's the THC. The anti-inflammatory effects of the product are irrelevant. Then we go with, why would we take it for AIDS? Nowadays we have drugs that AIDS is basically treatable, you know, so why do we take it? I think they listed this because of the anxiety, once again, associated with disease. Then we look at hepatitis C. Why in the world would we take that? I haven't figured that one out because there's no research. But when I go back to tell you about the dosage forms, the side effects, then you'll see where there may be some benefit or not a benefit from taking it. You look at amyotrophic lateral sclerosis. There's a lot of muscle spasms associated with that condition. So they know that it acts as a muscle relaxant. The actual process or the mechanism is still unknown. Okay, they do not precisely have any information because there's been no animal studies. I mean, can you do animal studies on marijuana and ask the dog how he feels? No, you couldn't do that, right? Or the rat, you know, how you feeling, rat? Then you've got Tourette's. You know what Tourette's is, right? Anybody doesn't know what Tourette's is? It is a seizure disorder where a person, it's like they call it tics. A person would do this or they would curse, and it just is almost like a spasm. And so you give them marijuana and it diminishes the occurrence. It doesn't cure it, it doesn't stop it. It diminishes the occurrence of the condition. Then we go to Crohn's disease. Crohn's disease is an intestinal disorder, an inflammatory intestinal disorder, an autoimmune disease. This disease is not caused by any factor, but it's one of those situations like rheumatoid. It's something that happens to our body. We study that. Now they have biologic drugs to treat it. Still doesn't cure it. Well, what does marijuana do? Once marijuana calms the stomach, increases appetite. Okay, we go to ulcerative colitis, similar type of disease. What does marijuana do? It acts on the receptors in the brain. Everything that marijuana does not act on the kidney, the heart, the heart or lungs or any other peripheral tissue. It acts in the brain, okay? Doesn't go to the joints. Even though you can rub it into a joint, it's still got to get into the bloodstream and go to the brain, okay? Then we have post-traumatic stress disorder. Post-traumatic stress disorder is an interesting condition. Most people who have post-traumatic stress, you find it in people in the military, but you've been in an accident and you come home and you remember everything and you're still disturbed by the event. You just somehow become restless or just disturbed by the event. What the manifestations of post-traumatic stress are uncertain. Everybody's different. Well, it tends to do wonders. I get a lot of referrals from the VA. Very few doctors can certify people for marijuana because they work for systems. Baptist doesn't allow their doctors to do it. The university doesn't allow the doctors because there's not FDA approved. They have no way to monitor it or guide it. When a person in Arkansas, we're talking about Arkansas, is allowed to take the drug because they choose to. All right, they choose to. They are not. There's a law called the Allen Law, where a doctor can recommend it. I could say, yeah, you can try that, but I cannot prescribe it. It's on you to take it. Okay, let's go. The other condition that we have here is fibromyalgia. That women who have fibromyalgia, the normal treatment for that is like naproxen, Cymbalta, and this is where a ladies they just hurt because our body is full of what we call fibrous tissue. We're connected by tissue, and all of a sudden, we just have soreness and pain everywhere, more common in women than men, okay? And you've heard that condition. Then we have Alzheimer's. Well, this one gets me. There's now a way to diagnose Alzheimer's, but they're saying treating it. Well, if you look up the literature, they said, well, how does that work? They have no literature on that. We would have to basically research through Israel. We'd have to go to Israel or Europe or Canada. And doctors are not allowed to use that information to treat people. I can't go research something in another country and then make it applicable to your condition, okay? Then we have cachexia, wasting. Well, people, when they have cancer, they waste, or some people, mental conditions. As a matter of fact, people with Alzheimer's, they have a tendency to lose their appetite and start wasting. So it's an appetite stimulant. We know that for sure, because I asked Garble the other day, I said, Garble, what is Zuzus? Garble says, what is that, Archie? That's a new word for me. And everybody knows what Zuzus is, not everybody, but I'm sure a lot of it know what that means. That means you become excessively hungry. You don't remember smoking in college and then you go eat after that? Okay, people don't remember that. I guess we do have some novice people here, huh? People who don't really know. But that is one of the biggest. I wouldn't call it a side effect, but that's one of the biggest. The munchies, we call them Zuzus. Yeah, okay. Munchies. Peripheral neuropathy. Well, peripheral neuropathy comes from several conditions. You know, it can come from an auto accident, diabetes, arteriovascular disease. In other words, you destroy the nerves in the peripheral part of your body. Well, it tends to reduce that pain and neuropathy people have. Now, they don't know why, but they know about receptors in the brain once again. We go back to these receptors in the brain, and then you begin to think. And they've delineated these things, but they just have not been able to actually observe the mechanism of action. Then intractable pain. This is where most of the people come in. I have about 3,000 people who see me yearly, literally, 3,000 people. Now, when we say anecdotal, that's the opposite of research. Anecdotal is information that is derived from experiences. Patients come in and says, this happened to my mother, this happened to. So when you add that up, the local government says, well, we got enough information from the people to say that this is safe. You know, the safety profile is really good. I'm going to explain some of the side effects, the side effects that may hinder people who take it. And obviously, they have done research on seizures. When you drink alcohol, alcohol lowers the threshold of what we call a potassium pump, potassium chloride pump in the brain, where if you drink alcohol, you tend to diurese a little bit more. You lower the threshold. That little foci, the little spot where the seizure's coming from, it goes off. But with tetrahydrocannabinol, which is alcohol, it suppresses seizure activity, which is really interesting. And they have several seizure medications for children only, not for adults, but for children with complex seizures, you know, intractable complex seizures. They're successful using that drug. Severe and persistent muscle spasms. So it works for that. It may reduce the anxiety, but once again, the receptors in the brain. Now, here is where that is very interesting. How do we take the drug, right? How do you take the drug? Some people know, some people don't know. But basically, back in the day, they didn't smoke it. I mean, I'm sure they smoked it back in the day, but from American experience, it was used as a liquid, and it was used as a balm or a liquid, but wasn't smoked. I mean, I think that's not true. I think people did smoke it. But the administration of the drug is now orally, okay? And I gave you examples. Gummies, it comes in gummies. I'm not endorsing this product, but these are the gummies. They're little gummies. You know what a gummy is. They're shaped in different colors and flavored. And the dosage form is very important because you have to pay attention to that. Now, when you go to the dispensaries, they'll say, oh, this is 10 milligrams, 15 milligrams, 100 milligrams. So you have to be very careful with that. And then as it relates to medicinal purposes, it is all experimental. I mean, you take one, and I give you one, and you said, yeah. But the length of time that the drug is going to last is about 6 hours, 6 hours. The onset of action could be anywhere from 15 minutes to 30 minutes. If you smoke it, and here is the smoking form, it comes in a flower. They usually use the flower, the bud of the drug. I'll pass it around for people to look at. I'm not endorsing this. Yeah, I'm not endorsing that, but it has a pungent smell, and it says on the container the dose per gram or milligram, okay? Now, when you smoke it, it's gonna work a lot faster because it goes through your factory system. We always think that we smoke something that goes in our lungs. As a matter of fact, it actually goes into our factory system quicker than it goes into our lungs. And then you have my favorite one, and I'm going to explain this one to you. This is a tincture. When I was in a residency, I did neonatology. We would have these children who parents were drug addicts. So when the child was born, the child was a drug addict, but the child had to withdraw. So the child would just shake. And so I would have to get up every morning and I would have tincture, a little drop of morphine. And I'd give that little kid 6 drops of morphine. And then the next day I would give her 5 drops of morphine. And then, I was giving that kid 6 drops of morphine every 4 hours. It wasn't, that day. And then the next day I reduced it to 2 drops every 4 hours. Then I was able to go so many drops, and then I was able to go every 6 hours, and then finally you took the child off it, but they had to reduce. Well, we don't have that with marijuana. We don't have withdrawals off of marijuana. If people do have withdrawals or addiction, people who are not addicted to marijuana, I think there's an addicted person that they just like using it, but there is no physical withdrawal from marijuana. And so this is a tincture, just like the little drops, like an iodine drop. Now, you have to be careful with this, because most people will take a drop and say, oh, I'm not high. And then they'll take 2 drops and they'll be ripped for hours. Now, I'm gonna give you an anecdotal situation that happened. Garbo's mother lived to be 97, Miss Watson, wonderful person. So Garbo and them, every time Miss Watson got sick, they called me. And they said, oh, blah, blah, blah. And they said, oh, we're gonna put her on hospice. And I volunteered, let me have Miss Watson. So they said, what do you wanna do? I said, go get her some marijuana, get her off the hydrocodone, because the hydrocodone causes constipation. It's probably one of the biggest problems. Stops the bowels. If your bowels stop, it's worse than anything, right? So what happened, we gave Miss Watson a drop. First of all, I tried it that Saturday. I took 2 droppers and realized that you don't take 2 droppers, because I think when I took the 2 droppers, I went all around town eating, and I was everywhere. I was saying, what are you doing? So what we did was we gave Miss Watson a half a dropper. Now this is important. Now here this is something very important to talk about. People talk about, well, what type of marijuana do we have? We have sativa. They talk about hybrids, but basically you got sativa. Sativa makes you want to go cut your grass, okay? Indica relaxes you. So Miss Watson was in a lot of pain. So we decided to kind of experiment. So we gave her the indica to relax us. Do you know when we gave her that indica, she had a bowel movement, they set her up and she turned pink. She stayed that way for almost a year. We alternated the sativa with the indica. When we wanted her to be a little bit more brightened up, we gave her the sativa. When we wanted her to rest at night, we gave her the indica. And she did quite well with that. Now, before we finish this thing or go further, there are some side effects. And this is associated with almost any drug, because almost every drug is metabolized through the liver. Now, you recognize that marijuana has a half-life. That means you're going to feel the effects for anywhere from 6 to 8 hours. Now, but why does it stay in the liver so long? They said because it is absorbed in the fat tissue, and then it takes 24 hours before it is undetectable or minimally detectable. So there are drugs that we have to recognize that you have to be very cautious if you're going to take. If you're on warfarin, we know what warfarin is, right? It's a blood thinner, common blood thinner. But it's less used now because they have Eliquis and they have some other drugs now that replace warfarin. Then erythromycin is an antibiotic. It's a common antibiotic that's used. When you get a Z-Pack, that's erythromycin. Why do they do that? Because if you're allergic to penicillin, they're going to give you an alternative. It's usually erythromycin. Then you have cyclosporin. Now, cyclosporin is a drug used as an anti-immune drug. When people get a transplant, they give them cyclosporin. It depresses the immune response, because once you get a liver transplant, you don't want the immune response. You want to suppress it. So you have to be careful with that. Even losartan, when you know what enalapril is, lisinopril, you know what those drugs are, blood pressure medication. Well, losartan, for some reason, has an interaction. It increases the effect of the blood pressure medicine. And diltiazem, which is Norvasc and nifedipine, you've had those are common drug drugs. Now, drug interactions. If you drink alcohol and you smoke, it basically increases the sedation. I mean, people who smoke know that if they're drinking and smoking, they're going to get ripped. And you saw if you ever seen Dave Chappelle, he has this thing where he's in a car and the police stop him and they ask everybody to get out of the car because they think they're drunk, right? And he's ripped, everybody's ripped, but they test everybody and their drug levels are high. So they tell them they can't drive. And they test Chappelle and they said, you could drive, because they don't test for marijuana, they don't do breath tests for marijuana. So he got away with it. But anyway, and then certain sedatives, you take certain sedatives, it's going to increase the efficacy of them. That means how they work, okay? Now, one of the big things is dosing, right? We're all about dosing. Right, well, how do you dose it? Anybody in here know? Because I don't know. Well, the dosing form will come in so many milligrams per cc, so many milligrams per whatever the weight is. When you read, they'll say, generally, you can go 10 to 20 milligrams, your initial dose, okay? Now, some people, they get high from that, and then basically high, because what effect are you looking for? You're looking to get the psychoactive effect, psychedelic effect, the pain relief, but CBD does the same thing. It gives you also anti-inflammatory effects. But the one basically on the high effect, you can pretty much measure that. Anti-inflammatory effect can last for a day or two. Once you reduce inflammation, do people know what inflammation is? Everybody says inflammation. You ever said arthritis, pneumonitis? Everything has an itis on it. That word means inflammation. That means swelling, redness, heat, and pain. Okay, that's what that word means. And so these drugs are marijuana is supposed to reduce that biological process. We know that. But how does it do that? That's the question. How does it do it? Well, we know about the brain. Most people, we believe that it's mediated through the brain. Period. It's mediated through the brain. So back to the dosing form, we are very uncertain as to, you go to your doctor and he says, well, how much should I take? And he'll say, maybe you should go see Dr. Hearne. Well, I don't know either because I'm not an expert. I don't, like I said, I will recommend it, but I don't prescribe it. I can't prescribe it. I could certify you to get it, find out what your problem is and say, well, then when you go to the dispensaries, now the dispensaries have gotten, Arkansas is considered one of the best states for medicinal marijuana because it's so highly regulated, very regulated. And so when you go to the dispensary, if you look on the label, it tells you on the label the dosage. It doesn't tell you how much to take, but you can assume that if you do your reading, you'll say, well, 100 milligrams might be a little bit too much, so maybe I should start off with 10. But the recommended thing, what are you taking it for? Now, I'm not suggesting that you take it for anything but medicinal reasons. That's I have to say that you take it recreational. We're not in any other state that is allowed recreational. I can't say, oh yeah, let's go get some, have a ball. So my suggestion is that that I would recommend that people take it. Now, back to the 3,000 patients I have, it's 60% are Caucasian, 75% are over 70 years of age. You understand? 75% of people I see are over 70. I had a lady come in. The first person that came in was a teacher from Pine Bluff. She's about 6'2", African-American lady. And I said, man, what are you going to do with this? And I'm thinking that she's going to get some balm and rub on. She said, what do you think I'm going to do with it, son? I'm going to smoke it. I have farmers that come from Scott, Arkansas. Farmers, they come every year. They've been coming 4 years. I have people coming from all over the state, and the majority of people are coming for neuropathy, pain, post-traumatic stress, and fibromyalgia. Not a lot of seizures, not a lot of Crohn's, not a lot of AIDS, not a lot of cancer. You know, and then the people that have come to see me, all socioeconomic backgrounds. As a matter of fact, I see less young black men and women coming. They're starting to come. The reason that people in our community didn't come because of the legal issue. People used to get arrested for it. Now they made it legal, everybody can have it, but people are still hesitant. Now, there's a reason I tell people, I said, if you're smoking off the street, that's not a good idea because it's contaminated. You know, the pesticides, people grow it faster, they're putting things in it. So basically, if you go to the dispensaries, they're very, very secure. The way, I mean, antifungal, antibacterial, contaminants, they test for all that. This state is super in terms of its dispensing of the product. Okay, any questions? No samples today, no samples today. So we'll pass this around and let people, and then look at the back of that, the tincture. Yeah, glaucoma. We're gonna take a couple minutes for questions.
No, I noticed you didn't say anything about the glaucoma.
Oh, the glaucoma.
You know, when it started becoming popular to have
Yeah.
medicinal marijuana, everybody was, I'm taking it from a
Glaucoma, yeah. Now, you have to be very careful because you have different types of glaucoma. You have wide-angle glaucoma that you may not want to take it for that. You have to determine what type of glaucoma you have. The eye doctor won't recommend it. They won't recommend it. So if you take it, he won't say anything about it. And you don't put the drop in your eye either. You smoke it, okay?
Dr. Hearne, I see you have this form here.
Yeah.
And so you give this person a prescription to get it.
No, remember, it is, no, let's get rid of the word prescription. You can only write a prescription that's something approved by the Federal Drug Administration. The states individually have decided that they would allow their citizens to use this. In 100 states, I mean not 100 states, didn't mean 100 states, but I think it was over 60% of the states have opened up. But some states are very restricted. California was medicinal forever, they went recreational. Arkansas, because of several probably ethical, moral, religious, political concepts, they don't want it to be recreational. I agree with that. I don't like to see it being recreational because I don't want to see 18, 19 years old, everybody's high. You know, so the medicinal part is kept it under control and regulated it.
So what's the process?
That's what I was going to get at. That if you decided that you wanted to do it, you have to meet those criteria. That means, but if you're 50 years of age or older, everybody in here qualifies for it. Because everybody's got an itis, joint pain, back pain. I don't think anybody in here does not have some arthritic issue. So you qualify for it. So you fill out the form, like that form. I gave people an example of that form. If you don't have one, I'll give you one. You fill out, it's 3 forms, it's actually 2 forms. One, that's what I have to give the patient to certify. I have to sign. You notice my license and the stuff is already filled in there, so I do so many of them. Then I have to fill out the top and then write which condition you have that certify you. Then there's another form, all demographics. You go apply for it, you got to do the demographics, put that in there. You go to the health department. First of all, you have to pay the doctor for the certification. You go to the health department. You can walk into the health department. You can get online. You can mail it. The health department charges you $50 every year. And then they will either give you a temporary card online or they will mail you one within 2 weeks. And with that card, it looks like a driver's license, your picture's on it. You take that to the dispensary, and you go in the dispensary. I'll tell you what happened. Garba went into the dispensary and did this. Garba did this at the dispensary. Because she thought, the first time she said, wow, they got this stuff in there. No, the dispensaries are like jewelry stores or like a candy shop. Very nice, nicely appointed. And when you go in there, it's confusing. But you go talk to someone, and you say, well, I got glaucoma. Then they'll recommend something. They don't prescribe either. They'll recommend a particular product. And then, for example, this will cost you anywhere from $35 to $60, depending on the strain, and they make all type of strains. That means they're taking these plants and they're grafting them and doing all type of, they're trying to increase the potency, basically. That's what they're trying to do, so they can charge you more. This costs you about $45. That little container somebody stuck in their purse, I had to have it back. Go ahead, John.
Okay. Before a patient can get this, and when they come to you, what do they have to bring to you for you to certify?
Nothing. It says here, it says, I hold a valid unrestricted license in the state. I am a professional in opinion after having completed an assessment. The patient comes in and talks to me briefly. And some people, when you do the renewals, you don't have to do that. When the initial person comes in, like a person comes in there at 21, says they got seizures, then he brings his seizure medication in there. You got seizures, okay. Oh, you walk in there, you don't have to bring me any medical records. I said, I know you got some knee joint pain, neck pain, creaking. I mean, I have not had any legal issues with it. I haven't had any suits, lawsuits. People that come in have been coming in for 3 to 4 years. And then this is the anecdotal thing. I said, how's it doing? They said, I'm back for the 3rd, 4th year. So obviously, it's helping them. I haven't met anyone who says, this stuff isn't doing anything for me. I would say 100% of people who come back, actually, it helps them. Okay?
Can you address CBD?
CBD is one of the products of marijuana. It is they call it a endocannabinol. And it is one that also reduces inflammation. It has receptors. We have several receptors in our brain. And this product can actually go to that part of the brain and induce inflammation. It's less, but it doesn't get you high. And then you have to be very careful going to get CBD because CBD, you have some people who are really do it really well. And then some people are just selling. They're you have to really take a lot of plant and go through the distillation process to get the CBD out. When you get the CBD, it is legal. You don't have to have a license for that. It's sold on the street. It comes from hemp. Hemp is the plant that makes less of the psychedelic flower part. Makes very little flower, mostly. And then they extract the CBD out of that, and then they sell it in balm, ointments. Very little smoke. One of the things that people don't really smoke CBD. They usually use it as a balm. and it helps with inflammation. So, but if you take the regular marijuana from the dispensary, it has CBD and TCH. Sometimes it'd be 3 to 1, 1 to 3, or one part CBD, 3 parts marijuana, or 3 parts CBD and 1 part marijuana.
How would you know if you're getting quality THC?
You'd get that, you go to dispensaries. There is no lack of quality in Arkansas. There's nobody selling any junk here because they are monitored. They have labs, they have to get their stuff tested all the time. You know, you'll see on the pack, that's why your name is on there. They know exactly who got it and who it is. CBD, on the other hand, is so commercialized, and 70% of it is a lot of false advertising. 70%, they said, they did a test on all the CBD products, and it didn't hold up. So you got to find a CBD shop that has a reputation. Yeah.
What's the difference between Delta 8, Delta 9?
That's a CBD product that they were selling, and it had a little psychoactive part to it, but I think they took it off the market because I think they were infusing it with something. But it's a CBD product.
What about
Terpenes? Terpenes are another product. They're another type of cannabinoid. I saw that. It's a whole program on that. But they're just, like I said, there's 100 different products in CBD, but terpenes are another one of those categories of plants that you can go with. But this is not part of my lecture. But that was part of, there's a great, I listened to several sources. I use Mayo Clinic. Mayo Clinic is out of Rochester, a very famous clinic, right? It's like Cleveland Clinic, one of the great healthcare institutions in the world, a Mayo Clinic and also Cleveland. So Mayo Clinic you can get online, you can go to YouTube and you go to Mayo Clinic and it sits there and it talks about, let me see if I have that one. Mayo Clinic, and it says medical marijuana benefits. On the top of your form, you'll see if anybody didn't get this. On the top of your form, you go to that website, and it says Mayo Clinic, the benefits of marijuana. Do you have one there? Yeah, no, that one. You got one. Yeah, no, it's at the top. Yeah, that website. You just go Google medical clinic, Mayo Clinic, medical marijuana benefits. It's a great article. As a matter of fact, it's actually a discussion, and they're very clear. I mean, even for a person who is not medically inclined, that discussion is really good. Anytime I have an issue and I want to show a patient a condition, I go to Mayo Clinic because it puts it in what we call lay terms. Did you get one of these? Look at the top of that. See that address on the top? Yeah. You go there and it talks about what you had brought up because they had a whole discussion, not a long discussion, but a brief discussion of those products. They had some other products too over there.
Is it good for insomnia?
Oh yeah, sure. That would be the indica. That would be the indica. Yeah, that helps you, makes you somnolent. Yeah.
Dr. Hearne, how long is that the flowering plant in the little jar?
Yeah, this is the flower.
The flower. And how do you use it again, and how long would a jar?
The flower, you're going to smoke it.
Oh, okay.
You're not going to rub it. You're not going to. Don't put it under your tongue.
Okay, all right. How long would a little jar like that last?
Oh, depending on how frequently you smoke.
Oh, okay. Is it 1 bud per cigarette?
No, it doesn't work. No. No, it doesn't work.
I was looking at the buds. How do you use that? That's what I was.
You have to go to the dispensary, and they sell paper. And now contemporarily, young people put it in a blunt. So if you go to Europe, if you go to Amsterdam, they're going to give you a tray of the marijuana and some tobacco. And then you'll roll your tobacco with the marijuana. That's a standard.
Sell the cigarette papers there?
They sell cigarette papers there. You've never, You can put it in a pipe, but you do smoke it. Yeah, you smoke that. While on the other hand, the gummy. Any questions? Yeah, smell. Yeah, get contact. Now, the other thing is that you can get a contact high. You've heard that before. You can be in a car with someone smoking a marijuana, Triopia. Marijuana is about less, maybe 2.5 inches. You know, they roll it up. You've seen people smoke before. People smoke all the time. You know, they roll up their cigarettes. And so a marijuana stick, you smoke that with and that's gonna last you, 8 hours.
Okay, so, and they'll tell me all of that about how to use it?
Yeah, they tell you how to use it. Tobacco, yeah, people traditionally mix the marijuana with tobacco. Yeah.
So I'll get a mild effect if I mix it with tobacco?
No, you get the same effect. Well, it adds a nicotine, so it's probably more of a stimulant. Yeah, people do that. Well, depending on, as it relates to medicinal purposes, I don't think it's indicated. Yeah, this straight up marijuana, THC and CBD are the ones used for medicinal purposes. I'm not going to talk about the highs, because I'm not.
I got one more question. So if you use this minus tobacco, do you get the same, does this have the same problems as tobacco?
No, the nicotine, see, tobacco, the problem with tobacco, the problem with tobacco is the byproduct, the carbon that gets in your lung over time. The other problem is the nicotine. Nicotine is a stimulant. And don't you remember being in school, you took biology, some people did, some people didn't. They would take nicotine and put it on the little frog heart, and the frog heart would do like that. So when you smoke nicotine, it increases your heart rate. No, it doesn't do that. Generally speaking, it doesn't do that. So people, when they're smoking a blunt, and they said, oh, I'm getting a little, that's from the nicotine. It's not from the marijuana. The marijuana will initially, you get that hit, you get the little euphoric feeling, might get paranoid, and over a period of time, it all eases out, and you stay.
The half-life is about 6 hours?
Yeah, the half-life is 6 hours for a certain amount. Not now, if you just suck down a whole joint, it might last a while, but generally it's gonna go away in 6 to 8 hours, the effect. Okay, sativa or indica. The gummies, you gotta be careful with the gummies. The gummies have an intrahepatic circulation. You eat a gummy, it's gonna go through your system. It's gonna go, and it'll be metabolic. So gummies might prolong things, especially you eat a gummy and you ate some food or something, and all of a sudden you're sitting there, about 3 hours later, and you said, whoa, God, what happened? Because the gummy finally got absorbed in your system. It's absorbed in the gut. Yes, okay? Any more questions?
Informational, what'd you say? Let's give him a hand. So, Dr. Hearne, are you feeling generous today?
Yeah, we're gonna give away some, if you are interested in getting a card, you would just call the office and they will make arrangements for you to get the card. And then, but we're gonna give away, we're gonna give away one certification, and we're gonna give away a book also, a couple of books. Did everybody put their card in there?
Okay, so part of Wisdom Wednesdays is you come and you're fed. Your soul is fed, and we have door prizes. And today we have a very special door prize. He's going to give away one
Certification, yeah.
renewal,
Which is worth
or
$200.
renewal.
Renewal will be $100 for renewal.
But that's worth it.
That's worth it, yeah.
Okay, so, and if you win it and you don't use it.
It's on, yeah, go and talk. They can hear you. They can hear you. But it is a draw. We have 3 books that we're giving away, and then Garbo has.
We're giving away one book.
Oh, those books? You're not giving those?
Their choice, one book of their choice, and then we're giving away a certification.
Certification.
And then I have 2
Gift certificate,
cards
yeah.
for your child for the Bail
Book,
Book
book,
Club.
yeah.
So which one do you want me to do first?
Certification?
All right, well,
So
okay.
then
So much for books and education.
this guy, pick the number. There you go.
Okay,
Pick the number and pick the number.
does everybody have a, who is number 17?
17.
Renee? No.
She's not here.
Oh, You're right. She left for the
Did she
day.
leave?
She left for that. We don't know.
Well, she works here too, so.
Yeah, she works here. She can't win. You work here, you can't win. You work here, you can't win. Number one.
That would be.
So you get a free certification. Yeah,
Okay.
free certification. That's to work $200.
So the second gift, there are 3 books on the table, and you get to pick the book of your choice.
Why don't you bring the books in here?
No, they're on the table.
Okay.
They'll go out there.
They're all about marijuana. So yeah.
Cannabis.
Cannabis. Yeah.
And you can also buy them too. Okay,
Number 18.
number 18. Paula Rogers.
Paula, you take one of those books off the table.
Okay.
Yeah.
And so next we have our gift certificates for our Baobab Children's Book Club. So it kind of works like grandkids, grandkids, grandkids.
13.
Wait, let me finish talking about what it is.
Yeah,
Okay.
yeah.
Okay. So basically, what we're going to do is on your child's birthday or your grandchild or your love child, whoever, or it could be you, whatever. They get a book, and then every month they'll get a book in the mail, and then we also have a um, digital opportunity where they'll be on a Zoom with our young lady who lives in Philadelphia who handles our book club. And so they'll get to read that book with her. And we also have authors on that Zoom. So that starts. So see me about signing up for that. And
Now, what do they get?
they're getting a gift card to start off the library collection.
They get one book, or they get a book all that stuff.
Today they're getting a gift certificate.
And they get a
And
gift.
then they can sign up for the club.
But anybody can sign up.
Anybody can sign up, but we're trying to help start libraries. Number 13. There you go. Can you trade it in for a card? No, she cannot. All right. So there's one more. Yes. One more, unless you can buy it.
Number 11.
Number 11. Who's number 11? Gerard. There you go.
Yeah. So she gets gifts.
All right. So thank you, Dr. Hearne, for that informative conversation. I'm sure you added a little humor to that, put all of it back in the
Back in the safe.
Okay. So next is our very serious part. We have Ms. Camille Watkins to come up and talk to you about signing up for that all important Medicare and how it works, and especially now that the Affordable Care Act has changed monetary value. She'll have some information and she's going to talk to you a bit, and then she'll be in the second gallery if you'd like to talk to her personally.
Thanks so much. As you all may well know, your Medicare annual enrollment runs every year from October 15th to December 7th. But that's not the only time that you can make changes to your plan. Depending on your coverage, right now you're in an open enrollment period from January the 1st until March 31st. A lot of Medicare beneficiaries, not necessarily everyone, has the opportunity to choose another plan for the year. Then, after April the 1st, all the way to the end of the year, December 31st, unless you have a special circumstance, you're pretty well locked into your coverage. And a special circumstance may be something like you move to a new county, you move to a new state, or maybe your health changes, or you enter a nursing home, or you leave a nursing home, or a skilled nursing facility. So just know that you always have options to adjust your plan to fit your needs. That's the most important thing. Another thing is you still have time, if you are not a Medicare beneficiary, to enroll in an Affordable Care Act plan. Now, I know we all hear right now what's going on, and some people may be a little confused. The Affordable Care Act plans are still available, but what's at risk or on the table are the subsidies. And what the subsidies did was they actually paid part of your healthcare premium for you. Depending on your income level, it could pay most, if not all. But just know that the plans are still available. You may have a higher premium. And for everyone in general, it's a new year. If you haven't reviewed your benefits, review your benefits and make sure you understand the changes for 2026. And you may need to activate your new healthcare card and those kind of things. Any questions y'all have, y'all can always go on to the website, watkinsinsurance.net. And like Garbo said, I am here if you want to ask any personal questions or anything I can help you with. Just let me know. And thank you so much.
So thank you all for being here today. Our next Wisdom Wednesday will be January 21st, and we will have Mr. Hiawatha J. Jordan, who will be discussing financial literacy and retirement resources. So this is very important as we move into this stage of our life. But we do have one of our presenters in March here. I'm putting her on the spot, Ms. Triopia Bryant. Would you stand up and talk about what you're going to be doing in March? Just so you know, we have a lot of fun here.
Well, I'm excited because in March I got a chance to share one of my favorite things, and it has to do with how we entertain, celebrating holidays. And believe it or not all the holidays that we celebrate are on the calendar that you receive every year, because I know that you make your own holiday calendar. So I'm really excited and would like for you all to come. And there'll possibly be a holiday treat, because whenever I speak to any group, it's always a holiday.
And when is that again?
This is the second Wednesday in the second meeting in March.
And in February, we'll have Carla Daniels, and she'll be talking about dealing with the loss of a spouse. And then Becky Finney will be on the 18th of February. How do I sell my house? I'm downsizing. What do I do? So, and if there are any particular topics that you all would like for me to research and have someone come and talk, please share that with me, because we will be doing this series through May. We'll take a summer break, and if you all desire, we'll do it again next year. So thank you so much for being here, and we'll see you on the second Wednesday in January, right?
Thank you.